Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. Have you gotten your COVID-19 shot yet? There are residents in our state who've been eagerly waiting for the vaccination because they have certain medical conditions, or they simply don't have the luxury to work from home. They are essential workers, like grocery store employees who thought they'd be next in line after senior citizens. But now Governor Lamont has a new vaccination plan, an age-based distribution plan. Today, Where We Live, how does this new plan to distribute the COVID vaccine in Connecticut affect you and your family members? We invited the state's top public health official to explain the strategy and take your questions too. Dr. Deidre Gifford is Connecticut's acting commissioner of the State Department of Public Health, and here's the number to call, 888-720-9677. That's 888-720-WMPR. You can share a comment on our Facebook page and find us on Twitter at Where We Live. Commissioner Gifford, welcome back to the show.
Thank you, Lucy. Thanks for having me.
Now, there's been a lot of talk since Governor Lamont announced this change in the vaccine distribution plan. I wanted to focus on a quote from the governor's spokesman, Max Reese. He told the Connecticut Mirror that, quote, an easier process makes it more equitable instantly. Now, we know that not all public health experts agree with that. You're the co-leader of Connecticut's Vaccine Advisory Committee. Can you talk about how you came to this decision to switch approaches midway through the rollout, Commissioner?
Sure, be happy to. So the first thing to remind everyone is that we don't have yet enough vaccine to vaccinate everyone in the state who would like to receive a vaccine. So by definition, we are like the rest of the country, faced with a situation where we need to devise an equitable and fair and efficient process to vaccinate the most people as quickly as possible. The priorities that the governor and the advisory group set were to reduce severe illness and death from COVID with the vaccine rollout, and to do that equitably. So that's what we set about to do. And as we sat down to look at the list of who might be next in line for vaccine based on some of the CDC and other recommendations, and also began to get lots and lots of input from people around the state about who they thought should be included on that list, we quickly realized that the next phase was going to be very, very large, and we didn't have enough vaccine to vaccinate all the people in that group at the same time. So we were going to need to work backwards somehow, even within that group. And the way that would reduce disease and death the most would be to work backwards by age. So either way, we were faced at looking at an age-based strategy in this next phase of the rollout. In addition to that, we quickly realized, as have other states, that it was going to be very challenging for individuals who live in Connecticut and our vaccine providers to understand who was really eligible in this next phase. Did you need to have a doctor's note or some other kind of verification to demonstrate that you had a chronic illness? Some states are requiring that. Did you need to provide proof of employment? Some states are requiring that. And those things really favor people who are employed, people who have a regular source of care or maybe have better connections with their physician or provider. It favors people who have time and resources to navigate a fairly complicated system. And that's where you get into problems with equity. So what the governor realized and decided was that the fairest and most equitable way to reduce severe illness and death with this vaccine strategy was to simplify the process and go backwards by age.
But Dr. Gifford, is it fair when we look at the people who will be vaccinated next? Certainly there's been a wide call for teachers in our state to be vaccinated because it's been a push from this governor since the summer and before school started that schools need to be open. But at the same time, we have essential workers who've been doing their job since the start of this pandemic, and they're not in controlled environments like schools where a lot of rules, safety guidelines are being followed. So how is it fair to other essential workers to say, okay, we're finally going to vaccinate teachers, but the rest of you are going to have to wait?
Yes, I want to say that I certainly understand that people who have been working as frontline essential employees since the start of the pandemic may be wishing they could get vaccinated sooner. I certainly understand that. One of the things we did when we rolled out the strategy this week was to show everybody when they would be eligible for vaccine. And this is a real advantage to the strategy that the governor announced. In other states, it's not clear who even qualifies as a frontline essential worker, and it's not clear when the people who fit those categories will get vaccinated because the group is so large. What we've been able to do in Connecticut is say, if you're a frontline essential worker and you're 55 and older, you are at the highest risk for a bad outcome from COVID. You'll be able to start getting your vaccine next week. If you're a frontline essential worker and you're 45 and older, you'll be able to start getting your vaccine after about the third week of March and on down the line by age. So I understand that our frontline essential workers have been doing terrific essential work. We are grateful for that. And now they can look at that calendar and know that when they will be eligible for vaccine. The other thing to say is that had we gone with the previously considered strategy, many of our frontline essential workers would have actually received their vaccine at the same time that they'll receive it now, because the group would have been so large that phase would have stretched out over months instead of just a few weeks. So in actual fact, many of our frontline essential workers, the oldest ones, will get the vaccine sooner, and the younger ones may be getting it at the same time they would have received it under the prior strategy.
You can join our conversation with the acting commissioner of the State Department of Public Health as we talk about this new vaccination distribution plan in our state. The number 888-720-9677, or find us on Facebook and Twitter at Where We Live. You mentioned that it's important to come up with a plan, and the governor believes this age-based plan will be efficient and equitable. A lot of people are questioning that when we see how it's rolled out so far for older residents in our state. The DPH data showing that brown and black residents in our state in these age groups, few of them have gotten the vaccine compared to white residents. So how will you make this equitable moving forward, Commissioner?
Yes, so that's the other key component of this strategy, which is targets for our vaccine providers and for the state for the administration of vaccine in high-need communities. So let me explain what that means exactly. We have identified, using a strategy that's defined by the CDC, certain zip codes in the state of Connecticut where people with the highest risk are likely to live. And we've been measuring how we're doing with our vaccine program in those highest risk zip codes, and we've shared that data with the public. And as you point out, Lucy, we're not doing well enough in those areas. We need to do better. So we've started by allocating vaccine to providers who are working in those areas and making sure that enough vaccine is being sent there. But that's not enough. You have to do several other things. You have to measure and you have to make that data available. So that's what we're doing. You have to make sure the vaccine is there. So we're working with our providers to make sure they have adequate doses in those communities. And then you need to work on the actual barriers that exist in those communities to getting vaccine. So some of those barriers that we've started to tackle with our vaccine providers the technology that was required to get an appointment. We realized quickly that was a challenge and a barrier for some populations. So we stood up our vaccine assistance access line with our partners at 211. People can get an appointment by phone. Right now, I just want to say that there is no wait time on that phone line. And appointments, if you're 65 or older, appointments are available now if you call that phone line, and I can get the number before the end of the show. So that phone line is also available in multiple languages.
If someone calls, Commissioner, if someone calls 211, can they also get connected to that number you're talking about?
Yes, although we prefer they call the number directly, and we will make sure to get that for you by the end of the show. Okay. You can also go, if someone wants to check the internet, they can go to ct.gov/COVID vaccine, and they'll be directed to that phone number as well.
I'll ask Commissioner, I'll ask our producer to look up that number so that we can make sure we get it to people soon. I wanted to take some calls before we talk more about the system in place to schedule these vaccines. Again, you can join us 888-720-9677. Acting Commissioner Dr. Deidre Gifford, she leads the State Department of Public Health, is here. Aaron is calling in from Deep River. Aaron, go ahead.
Hi, thanks for taking my call. The CDC guidelines clearly states that diabetes and severe asthma should be vaccinated next under 1B. And both of my husband and I qualify for this, so we've had our documentation ready for this since November. So I'm just wondering why the state hasn't done something similar already, since we knew this was coming up.
Aaron, thank you for your call. Go ahead, Commissioner Gifford, again. So from the beginning of this pandemic, the governor has said it's important to follow CDC recommendations. This age-based plan deviates from that. Can you tell us more about and explain to Aaron, who has a medical condition, why she has to wait?
Sure. And Aaron, thank you for calling, and I'd be happy to explain. So this is, your question actually illustrates one of the challenges that we were facing with this condition-based eligibility. So if you look at the list, which I'm looking at now on the internet, type 2 diabetes is on the list. Type 1 diabetes does not appear on the list. And actually, there are two lists published by the CDC. One list is of people who are at increased risk, and the other is a list of people who might be at increased risk. Now, if you look at the first list, type 1 diabetes is not included, nor is asthma. If you look at the second list, asthma is included, as is type 1 diabetes. So when we looked at those two lists, we realized that over 2/3 of the adult population were included. So the challenge, Aaron, and I certainly understand your desire to get vaccinated, and I hope you will take the opportunity to look at the calendar that we put out on Monday so that you can see exactly when you and your husband will be eligible for vaccine. It won't be too much longer. But the challenge that we had is when we looked at both of those lists and saw that almost the entire adult population would qualify, we knew that we were going to have to work backwards by age in any case. And so it would have been much more difficult for both you and for providers to have to decide how to verify who was eligible. So we decided to just go with age.
Stephen's calling in. Stephen, you have a question related to the disability community.
Yes, I do, and I'm with DRCT, and we represent a lot of folks in the disability community. And Commissioner, thanks for being here this morning, but I have a question. You talked earlier about reducing death and severe illness because of COVID and the equity arguments. We have people with comorbidities out there, people with disabilities out there, all of whom were viewing March 1st as a kind of golden date because they would be able to get their vaccines. Given that they are at much higher risk for contracting, higher risk for getting severely ill or dying if they get COVID, Can you give us an idea of what the thought process is behind removing them as a category and kind of folding them in with the age groups?
Sure, and thank you for that question. Yes, and first of all, we do know that chronic illness, the prevalence of chronic illness increases as people get older. So for people over 50 in the United States, almost 70% have some type of chronic illness. So that's where the chronic disease is concentrated, which is another thing that made us think about working backwards by age, in addition to the fact that 98% of the deaths from COVID in Connecticut have occurred in people over the age of 50. So if we go back to the question about who would have been eligible under the previously considered option, and you go to the lists that were produced by the CDC based on the evidence that they've seen, it had certain disabilities, but not others. So what we started to hear from lots of people as we considered that previous option was, please add this condition to the list. People with this condition should also be considered in the next phase of vaccine. And as we looked at the vaccine supply and realized that we didn't have enough to vaccinate everyone who wanted to be vaccinated right now, and we looked at the size of the group, once we considered all of these conditions and essential workforce categories, again, we realized that we had close to 2/3 of the adult population. We couldn't open up our vaccine schedule on Monday to over 1.5 million people, and we had to figure out a way to further stratify. So we decided that going by age, which is where the risk of chronic disease and the risk of death lies, was the fairest and most equitable way to reduce death and severe illness from COVID.
Again, you can join our conversation with Acting Commissioner Dr. Deidre Gifford, 888-720-9677. That phone number you mentioned earlier that people could call, Commissioner, it's 877-918-2224. Who are the people that should be calling this phone number?
Right now, anyone in Connecticut who is age 65 or older is eligible to be vaccinated. So, and again, there's no wait on that phone line today, and appointments are available. So I encourage you, and thank you for providing that number. I encourage people to call. Also, if you're a healthcare worker and for whatever reason you decided to wait a little bit to get your vaccine, you are still eligible for vaccination. So I encourage you, if you're a healthcare worker working on the front lines and you haven't gotten your vaccine yet, to call that number. Appointments are available.
Again, it's 877-918-2224. Again, we're going to talk more about the system in place as more and more people become eligible for the COVID-19 vaccine. Denise is calling in from Wallingford. Denise, go ahead.
Hi, good morning. I just had a question for you. When you talk about essential health workers, I work in a grocery store, and we have been on the front lines in contact with hundreds of people since day one. We were supposed to be eligible for the vaccine now, but we got pushed back, and I was just wondering why.
Hi, Denise. Thanks for calling in, and importantly, thank you for being on the front lines since the beginning of the pandemic. We understand that you're anxious to get your vaccine, and we want to get vaccine to everybody in Connecticut as quickly as possible. I don't know your age, Denise, but your colleagues who are 55 and older will be able to get their vaccine starting on Monday. And about 3 weeks from then, your colleagues who are 45 and older will be able to get vaccinated. And about 3 or 4 weeks after that, 35 and older and on down the line. And by May, everyone should be able to, in Connecticut, everyone who wants to schedule a vaccine appointment should be able to do so. So I totally understand and appreciate that you want to get vaccinated as quickly as possible, and that you have been on the front lines. I encourage you to have a look at that calendar that we've put out, and know that when your age group comes up, you'll be able to schedule a vaccine.
Denise, if you're still on the line, do you know when you're eligible now based on this new plan by the state?
I don't. I haven't looked at it yet, but I am 60 years old.
So that should be coming up for her soon.
Yeah. On Monday, Denise, you can call for an appointment. So that's the good news for you. 55 and older is eligible on Monday. So I encourage you starting Monday to hop on the internet or get on the phone, and you'll be able to get vaccinated.
Denise, you mentioned that you are a grocery store worker and you're 60, but what about your colleagues who are much younger? I had brought up the point with the commissioner earlier that, we want people to follow the safety guidelines, but I think any one of us can recall a time when someone is not 6 feet away or is not wearing a mask correctly. Is this something that you have noticed in your grocery store, and how does that make you feel?
Absolutely, and that's why I was so concerned about it. And, my fellow workers are too, because we're, like I said, in constant contact. It's kind of hard to follow the 6-foot rule. I work in the meat department, so I'm constantly, in close proximity with people. Fortunately, everyone's wearing their mask, but, in the beginning, it was scary. And it still is, because you still don't know.
Well, Denise, thank you for calling in. Go ahead, Commissioner.
Thank you, Denise. No, I just wanted to say thank you for your work, Denise. Thanks to you and your colleagues. And again, I encourage you Monday to go ahead and schedule an appointment as soon as possible for your vaccine. And thanks for calling in.
Again, I'm going to give that number out, 877-918-2224, for people who are eligible under this new plan starting March 1st. My guest today on Where We Live, Dr. Deidre Gifford. She is the acting commissioner of the State Department of Public Health. We're going to continue to take your calls and questions right after the break. We'll be back in 90 seconds. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. My guest today, Dr. Deidre Gifford, Acting Commissioner of the State Department of Public Health, as we talk about the state's new approach to vaccine distribution. You can join us, 888-720-9677. Before I take more listener calls, Commissioner, can you explain the system that's in place right now? So for a while, there was I think it still exists, the online system, VAMS is the acronym. People have been told to call 211. I've been giving out this other number that you say people can start to call again when they become eligible. And then there's healthcare systems that are also providing vaccines to particular communities. This seems very confusing. So what's the easiest way to tell people how they should be able to connect to a COVID-19 shot, Commissioner?
Yes, we understand, and we want to make it as easy as possible for people, Lucy. So thanks for asking that question. For people who have access to the internet, I would say the most straightforward way is to go to ct.gov/COVID vaccine. And right on the landing page there, you'll find a link to am I eligible or get an appointment. And you can click on that. It'll take you to a map and show you where vaccination is available in your area. If you don't have access to the internet, go ahead and call that 877 number. That's our vaccine appointment assistance line, and they will help you with a vaccine.
Now you can join our conversation with Commissioner Gifford. Let me take Michelle in New Haven. Michelle, go ahead.
Oh, hello. I'm a licensed practicing social worker. I work for myself, and I had a really hard time being able to find an opening for a shot. Oh, hello?
Yes, we're here, Michelle. Go ahead.
Okay, all right. I have 3 autoimmune diseases. I have heart disease. I'm 66 years old. I don't work for a hospital or a clinic, there was no way I could find to get myself to get a vaccine. So I mean, it sounds like things have changed a little bit since last week. I finally did get a vaccine, but it's kind of a hit or miss thing. It's really like gambling. You know, you go on sites and all of a sudden they're busy. I had my computer going, my landline, and my cell phone, and with all of that for 2 days, I just was not able to find an opening. They were closed in a second. So for people like me that are self-employed, there's no protection, no help for trying to get us vaccinated. We're just you're kind of just out there on your own.
Michelle, you raise a good point. I know that municipalities that have senior centers, that have libraries, they're all working to help people locally. And I'm wondering, Commissioner, is the state doing enough to help local officials get people like Michelle connected?
Yes, and Michelle, I'm glad you've got your shot, and I appreciate that it was a complicated process for you, but I'm happy that you got it in the end, and I hope you'll get your second shot soon. We have been, Lucy, working really closely with our local health departments and with our community partners around the state. We have a terrific team working with DPH and the governor's office that's on the phone every single day with our municipal partners, whether that's local health or mayors and first selectmen offices, other community organizations. They, in turn, are working with senior centers, faith-based organizations, senior high-rise complexes, all kinds of settings out in the community. That's the work we need to do to make sure that this process is fair and equitable. And we're busy doing that every single day. We need to do more. As you pointed out in the beginning, we have work to do to make sure that this process is reaching everybody in an equitable way across Connecticut. Mm-hmm. But the community partnerships that we built for our testing program earlier in the pandemic, we're using those partnerships now to get back out into the community and do our work around vaccines.
Was it a mistake for the state early on to roll out this phased approach when from the very beginning it's been said that with waiting for the vaccines to come online and get the FDA approval and then be manufactured, the demand was going to outstrip supply. And so now we've got all these people with expectations, Commissioner, some people who have been trying to do everything they can. And, it's a hard pill to swallow for them that they, if they're younger, are going to have to wait until May, even June, depending on what supply looks like, to get a vaccine.
Yeah. Lucy, I think people understand that we don't have enough vaccine to vaccinate everyone who wants it right now. I think people do get that. That's the big picture. That being said, we are less than a year into this pandemic. We're right about a year now from when things started. And here we are with a vaccine, highly effective, soon to be three vaccines that are highly effective against this virus. And we have over 45 million people in the 45 million doses given in the United States. Soon will be a million doses given just in Connecticut alone. So the progress has actually been extremely fast. I know people are anxious. It's been a very long and difficult and trying year for everyone. But in the big picture, the fact that we have three effective vaccines and we've been able to roll it out as quickly as we have is really very good news.
Doug's calling in. Doug, what's your question for Commissioner Gifford?
Good morning, Commissioner. Thank you for taking my call. So I work at a supermarket, and our customer count goes by the thousands in the course of a week. It's not the same people coming in, of course. Could be people from out of state, out of the county, out of the town, but it's again in the thousands. So when I was listening earlier, we were talking about teachers still being in a group to get vaccinated. I was just wondering if there's any data supporting the risk to teachers as opposed to those of the grocery store or essential workers that are out there meeting the thousands and thousands of people during a week. Company I work for has been great. Everybody's masking up, you're gloving up, washing your hands. However, without like an N95 mask, even with everybody wearing masks, yes, it does cut the transmission down, but it's still there. And you don't know walking up and down an aisle or talking from one customer to the other. Did somebody just cough right before you walk down that aisle? Something happened that you don't know what you're walking through. Of course, you have no control because you don't know what happened when you turn the corner. But I don't believe you touched on any data that you had comparing the essential workers in grocery stores to those of the teachers who are still to get the vaccine.
Thank you, Doug. Commissioner Gifford, go ahead.
Yep. Thanks, Doug. Thanks for the question. And again, I will say thanks to you and Denise for your work on the front lines during the pandemic. The risk to frontline essential workers really varies. In general, what we've seen is that in retail, the risk is generally low, as it is in schools. I think the emphasis on education has to do with getting kids back to school, which I know we all agree has been important for our children who've been out of school for so long to have the opportunity for an in-person education. And many children in disadvantaged communities in particular, we want to make sure that they have the best shot this year for an in-person education. That doesn't mean that your work in the grocery store isn't valued. It certainly and most definitely is. I'm glad that you have an employer that's emphasized the masks for both the customers and the employees. That definitely works, and it definitely cuts down your exposure. And again, I would say, please check, the calendar that we've put out. March 22nd, if you're 45 to 54, you should be eligible. And a few weeks after that, if you're 35 to 44, you should be eligible. And I hope and encourage you to get your vaccine soon, Doug.
Anne tweeted at us, Commissioner Gifford, and wants to know, what about the kids who have parents with comorbidities who cannot be in school? And now that has been pushed back when you talk about the importance of making sure that kids are in school. Some of them are staying home doing remote because their parents have medical conditions.
Mm-hmm. Well, what I would say is, again, we're working as quickly as we can, given the limited supply of vaccine that we have, to make sure that those individuals can get vaccinated soon. And, we're hoping to get good news about the Johnson & Johnson vaccine as soon as Sunday or Monday of next week, which means we may have even more vaccine supply coming into Connecticut. So we're working as quickly as we can with our vaccine partners to make sure that we have an efficient and speedy and equitable strategy.
Coming up, I want to hear more from the Commissioner about how marginalized communities making sure that it's accessible to them, what that exactly looks like in the next few weeks. But Al's been holding from Darien. Al, go ahead. Al, can you hear me? Well, it looks like Al isn't there anymore. Let's try Susan in Greenwich. Susan, are you there?
Yes, I'm here. Thank you. Good morning. I'm 65, and my question relates to the rollout. Like your prior caller, Michelle, I had quite a bit of difficulty with using every possible medium to try to get my first vaccine a couple of weeks ago. Fortunately, I have my first one today, but it was quite difficult and challenging. And I'm just wondering why the vaccine is being made available this coming Monday when some of my neighbors, for example, haven't even yet had their first vaccine, and they're 65 and older. My direct neighbor doesn't have her vaccine until March the 8th. And what does it mean for second vaccines? So I think it's a real concern in terms of this rolling rollout in terms of age. Mm-hmm. The capacity is something that a number of us are concerned about. If you could address that.
Sure. Thank you, Susan. That's a really good question. So what we have seen as we have done the prior two phases, when we've gone from 75 and older and then down to 65 and older, is that Once we reach about half of the group being vaccinated, we start to see empty appointments. And one of our premises is no appointments left open and no vaccine going to waste. And so, for example, if you call today to one of our retail pharmacy partners, and Lucy, we haven't talked about CVS and Walgreens, who are also now getting vaccine directly from the federal government. They are getting fairly large shipments next week. They will have new appointments available. So once we start getting about 50%, which is where we're close to now with 65 and older, we start to see vaccine appointments become available. So we want to get those filled. I would encourage your neighbors and friends who are 65 and older, if they don't have their appointment yet, call today. Call a pharmacy or call the 877 number or go online. I appreciate and understand that it was a little clunky for you, Susan, and I'm glad you were able to persist and get an appointment. But I encourage everyone who's currently eligible to go ahead and get that appointment scheduled. But we want to keep this moving. We're going to be getting lots of vaccine in the coming weeks, and we don't want a single appointment slot to be left open.
We're almost out of time with the commissioner. I have to ask, just to going back to how we started our conversation when we talk about the importance of making this efficient, but also equitable. When you look at the data
Right.
where there are disparities based around our state. So what does that mean when you're going into communities? Will you be providing transportation? Will these clinics be open outside working hours for many of the people who, again, have to do their jobs and have to figure out when they can get their vaccination too?
Yes and yes to both of those questions. So we've been working with our vaccine providers about, just as you say, Lucy, what are the strategies on the ground that we need to have in place to make this an equitable process? We've got people that have been working with us called community outreach specialists. These are individuals who are from these communities, live in these communities, and are helping us understand what the barriers are to getting a vaccine, and then helping our providers put in place strategies to address them. We're going to be opening up with partners from FEMA, a mass vaccination site in Bridgeport, and we hope that will be opened within the next couple of weeks. We will be reserving appointments at that mass vaccination site for people who live in Bridgeport, so that when you go to schedule appointments there, if you don't live in Bridgeport, you won't have access to those appointments. Many of our providers are using that strategy of reserved appointments for people who live in those communities. We're also taking the vaccine to where people live. So we've had vaccine providers out, as I mentioned, in senior high-rises, giving the vaccine there. We've had them out in senior centers. We're also making a big emphasis on people who are homebound. We understand that some people have a challenge getting out. So we have a team at DPH that's working with our local health departments on addressing that concern. So it's a multi-pronged strategy, but we're working every day to make it better, and then measuring what kind of progress we're making.
I want to thank Dr. Deidre Gifford for coming on the show to answer our questions and yours. Again, she's acting commissioner of the State Department of Public Health, and we appreciate your time, Dr. Gifford.
Thank you, Lucy. Thanks for having me on.
Coming up, we're going to talk more about this goal of making sure this process is both efficient and equitable. We're going to hear from a public health expert at Harvard, and you can join us too. Find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. We just heard from Connecticut's top public health official, Commissioner Deidre Gifford. Now, how can the state work on issues of access and also hesitancy when we talk about the COVID vaccine? Joining us now on Zoom, Dr. Bisola Ojikutu. She's an infectious disease specialist at Brigham and Women's Hospital. Her work focuses on addressing disparities in infectious disease risk, prevention, care, and treatment. Dr. Ojikutu, welcome to the show.
Great. Thanks for having me.
I'd love to get your reaction to hearing from Connecticut's public health commissioner about this new strategy. And again, there's an emphasis on making sure that it's equitable. But is that possible when we talk about this new plan to base it on age, Dr. Ojikutu?
So I really appreciate the commissioner's response in regards to equity, but I think it remains to be seen whether or not this approach will promote equity. What I can say is that if equity is truly a priority, then some of the discussions around prioritization, including age or comorbidities, unfortunately, it misses the mark. I mean, if you think about what an equity lens really is, it means that there must be priority on historically populations that have been left behind. So we need to be talking very intensely about how to prioritize individuals in hardest hit neighborhoods, how to put vaccine sites in those neighborhoods and make them accessible to local folks. Scheduling and must be streamlined and simplified, which was discussed by the commissioner. And I think also this idea of collecting better data. We saw this with testing, and we've seen it with other outcomes related to COVID-19, that we don't have great data in terms of race and ethnicity, as well as other demographics that are important. So I think all of that is part of taking an equity lens and really applying it to this rollout. The other thing, is that people have talked a lot about, increasing vaccine confidence, and we know that the numbers in terms of acceptability of the COVID-19 vaccines have been lower in most of the polls, particularly amongst Black individuals. So it's really putting resources into that and understanding it and trying to figure out, what are the best strategies going forward. And then, honestly, I think that much of what the commissioner said and much of what's being done, I think, nationally, is really, what she described and what I just described. What I would say is that we actually need to take this vaccine rollout, one step further. I think that looking at this in sort of a visionary way and thinking about the vaccine rollout in terms of equity, in terms of engagement of marginalized communities, as a way to look at how we can, create sustainable infrastructure in communities where we know that there are ongoing disparities. I mean, COVID-19 has amplified disparities. So how can we do things that are investing in these communities that aren't just sort of short term and then they sort of pop up and then they go away when people are when we've sort of gotten the pandemic under control, which is hopefully in the near future, fingers crossed. But how do we partner with communities in a better and more authentic way so that they're leading the way, so they're taking ownership of what's happening, and in not only building sustainable infrastructure, but increasing confidence in these vaccines and in the process, increasing our trust of what's happening.
We ran out of time with the commissioner because we had many listeners who wanted to ask a question. But when we think about disparities, looking at stark differences in life expectancies, in Connecticut, there was a Connecticut Health Foundation did a survey and found residents in Northeast Hartford on average have a life expectancy 15 years lower than just a few miles away at West Hartford, Connecticut, a much more affluent and whiter community. So when we think about an age-based approach to vaccine distribution, does that raise concerns, thinking about how someone who's 55 and affluent and white may on average be less at risk than a low-income Black or Hispanic resident? Dr. Ojikutu.
Of course, it raises concerns. I mean, I think this is really the elephant in the room. I mean, this issue of how do we create a response that truly targets those who are greatest at risk, and who are people who are not going to be able to access the system. So many of the callers in the last session, they talked about their difficulties and their challenges, but think about that for folks who are historically marginalized, who are, having many challenges, not just, well, I shouldn't say just, but not necessarily or beyond what was described, but much more than that, both historical and contemporary sort of challenges dealing with the healthcare system. And there's this, as I mentioned, sort of this divide between marginalized communities of color and institutions, whether it be healthcare systems, the educational system, so on and so forth. So you have to invest more in order to get folks to where other people are at. And I think it's important, though, in terms of messaging and in terms of creating a sense of overall community, that this isn't about us versus them. And I detected some of that in the conversation that, it's, why are some people being prioritized over others? Promoting equity means access for all. It means a better world for all. at the end of the day. I mean, we're all sort of struggling with this, and I think there are many challenges to promoting equity, to getting access. Certainly, there's supply issues in regards to the COVID-19 vaccine. But I think framing this as a way to, really address some of these challenges that have been so starkly highlighted, as you mentioned.
We just have a couple of minutes left, but again, your clinical work in infectious disease, are there some best practices, examples of getting it right that local health officials, even and at the White House, should be paying attention to?
Right. So I think that's a great question. So there's actually a great example of a rollout in Washington State that was being led by Native American or indigenous communities that was reported in the Seattle Times as a model for a community-centered rollout. So what that community did was they developed their own education and demand creation campaigns. They addressed vaccine hesitancy themselves. They discussed mistrust and the legacy of misconduct, research-related misconduct in their own communities. And they basically hired their own staff to make their own phone calls, to go door to door, to do boots on the ground. And they decided that they wanted to do drive-through vaccination. They said, that is what our community wants. We have heard from them and we are going to act on that. And they moved that forward. They took ownership of the process. Now, we actually know that interventions that are owned by and acceptable to communities, particularly marginalized communities, are the ones that are going to work best. So why don't we build on that type of model, really work in true, authentic partnership, decide what will work best within communities and move that forward and do it in a sustainable way that will, like I said, change what's happening.
Meanwhile, here in Connecticut, leading other states, when we think about how many people have gotten their first dose of the COVID-19 vaccine, as more of the population gets vaccinated, we all benefit from getting closer to herd immunity.
Absolutely. That's part of what the messaging should be. But this isn't about us against them. It's about us all sort of working together to get towards this blanket of immunity that will protect all of us and get us through this as a world. I think this is the way that the messaging should be promoted.
I want to thank Dr. Bisola Ojikutu, infectious disease specialist at Brigham and Women's Hospital. We appreciate your context to this conversation.
Thank you.
I'm Lucy Nalpathanchel. This is Where We Live. Today's show produced by Carmen Baskoff. Tess Terrible was on the phones today. Our technical producer is Kat Pastor. Thank you for your call-ins, and we hope to invite the commissioner and the governor on in the next few weeks to continue this conversation.